Welcome to Summit, hosted by BHAC and the BHAC Advisory Council. The purpose of Summit is to provide a virtual forum by which we check in with our BHAC members who have previously presented and shared work on health and wellness as a way for us to stay engaged with you in between our biannual in-person BHAC Summit conferences. This gives us an opportunity to see how the innovations are progressing. Today's presentation will be an update on Healthy UC Davis, UC Riverside Healthy Campus, and introducing USC's Healthy Campus.
Hi, everyone. I'm Stacey Brezing, and I'm the Director of Staff and Faculty Health and Wellbeing at UC Davis. And Julie and I presented back in 2019. I have my bachelor's and my master's from UC Davis as well. I have worked at UC Davis Health in their sports medicine performance lab. I've worked on campus as our student health and wellness health educator. And then I transitioned to occupational health to work on employee health and wellbeing programs. And right now I am doing health and wellbeing for all of our UC Davis employees.
And I'm Julie Chobdee. I have a bachelor's and a master's in public health from UCLA, and I worked as a wellness manager for Johnson & Johnson Health Fitness, then went into higher education as the wellness program manager at UC Riverside, and now I'm the health and wellbeing program manager at USC.
So last time we gave you a little bit of an update on our Healthy Campus Network. And so I will just give a brief review of what the Healthy Campus Network is all about. And then I'll go into a few updates of what we've been up to in the last couple of years. So if you all remember, in 2017 is when we started our Healthy Campus Network. So Janet Napolitano gave each UC a small amount of funds to build the infrastructure for this. We used a culture of health model to create our Healthy Campus Networks. We use a lot of collective impact. The Culture of Health Action Framework from Robert Wood Johnson, the Okanagan Charter really guided our work, and a lot of these items you see on this slide. So the update that we have for you all is that we have been working on a few projects system-wide. One is the Healthy Beverage Initiative. So this was a project where each UC also got a small amount of funds to put in hydration stations to promote drinking water, and a little bit for a campaign on how to make healthy beverages. So that one is now concluding soon this summer. We also had a Healthy Campus Network Summit, and the title, or the summit, was focused on the culture of health, confronting the entwined challenges of a pandemic and endemic racism. And we had a speaker from the Robert Wood Johnson Foundation for that one. And we've also been hard at work developing new system-wide goals to work on together. So you'll see those on the right of this slide. And in our advisory team meetings, we've been recently attempting to come up with a real tangible project that we can scale to the entire system. And lastly, a health in all policies. So we're really trying to use a health in all policies model on each UC and really change the culture in that area as well. So for Healthy UC Davis, which is our branch of the Healthy Campus Network, we, if you remember in 2019, you may not, but we broke our, areas of focus, or focus areas, into nutrition and food, physical activity, mental and emotional health and well-being, and smoke and tobacco free. And we funded projects in those areas. After 2019, we received 5 years of continued funding. We sat down and did some strategic planning. And instead, we started working on these priority areas, or work groups. And we came up with 6 that were important to the entire campus. The first was a communications work group. So really creating a one-stop shop for the UC Davis Health and Medical Center and for UC Davis campus to really house all of the resources and everything available to all academics, staff, and students. And then we also had a diversity, equity, and inclusion work group where we've been working on reaching out to different groups on campus and at UC Davis Health. And emphasizing really funding projects that have a key DEI impact. Leadership support, so continuing our work on engaging our leaders on our campus, our chancellors, our vice chancellors, Everyone gets a quarterly newsletter that has an update of what we've been up to. Metrics, so continuing to look for ways that we can measure our success. Physical space, so really looking at indoor and outdoor space and how we can change the environment in that way and what exists and all of that. And then lastly, policy. So this is one that we've been working on. For example, we are working on a food and nutrition service policy at the moment. And then in the last couple of years as well, we've gone through a request for proposals and funded some really exciting projects. This slide includes some of our older projects and our new projects. We have really focused on mental health, basic needs, and DEI projects. So we have an Amplifying Narratives to Promote Campus-Wide Wellbeing project that really promotes resilience and real narratives of students, staff, and academics telling their stories. We've funded a Weight Stigma project on campus, and a lot of neat, innovative ideas like the community healing through creative art expressions that uses silk screening to really get students to the resources they need. And another exciting project is the Open Space Inventory project, which really came in handy when COVID hit, because we had mapped out the entire campus and where the healthy spaces were on campus so that students, academics, staff could actually utilize those when it was deemed too dangerous to be inside.
Thank you, Stacy, for sharing all the great work you're doing at UC Davis. So here's a few updates from UC Riverside from 2020, which happens to fall during the COVID-19 pandemic. So while I was there at UC Riverside, we quickly worked with campus partners to support the physical, mental, social, and financial well-being of our faculty, staff, and students through a webinar series titled Attending to Your Health and Well-Being During COVID-19. We also launched weekly Stay Well tips, including strategies and resources on how to navigate the pandemic. In collaboration with various campus partners, we created a series of healthy cooking meal preparation videos, including recipes and nutrition facts, launched a Move More for 3 to 4 campaign, and offered several mental health suicide prevention trainings and a kindness panel with faculty experts. We also held a recovery symposium that included partners from other UC campuses. And then we addressed 2 emerging themes by holding a public health anti-racism forum. And we also conducted several focus groups with students, faculty, and staff to better understand the beliefs and attitudes around the use of COVID-19 public health safety measures. And we have published a paper with our findings. To support faculty, staff, faculty, and students, we created a well-being in learning environment, which is basically a healthy pedagogy guide, providing ways for faculty to support student well-being, learning, and academic success remotely and in person. Our team also conducted several presentations on healthy habits while working from home. In December 2020, I left UC Riverside for my current position at USC. Since then, I've been working on developing USC's Healthy Campus, and I'm pleased to share the strategy as it is today. It covers 4 key areas. One is to increase awareness, education, skill building, motivation, and behavior change through promoting existing resources, wellness program, and education. 2 is to build a framework for creating a culture of health and well-being through our senior leader champion, advisory committee, wellness ambassadors, and supporting USC's culture journey work, which has identified well-being as one of 6 unifying values. And 3rd and 4th, we're looking to embed and infuse health and well-being elements throughout USC's practices, policies, and systems, as well as the infrastructure and the built environment. The ultimate goal is to create and sustain a healthy work, learning, and living environment at USC. Our strategy is informed by the collective impact model where we will operationalize the strategy through our Healthy Campus Advisory Committee. And this cross-sector collaboration of faculty, staff, and administrators will provide strategic guidance and direction, with myself chairing the committee. Evolving from the committee will be work groups or subcommittees formed based on our needs assessment as well as committee input. Work groups will include chairs and members tasked with researching best practices, strategies, target indicators, and developing an action plan to support the overall Healthy Campus strategy. And then finally, we will have a large team of ambassadors across the university. And these will be teams of school and unit representatives that will disseminate programs and provide feedback to allow a bidirectional flow of information. And here's just a brief look at some of the key highlights accomplished over 2020 and 2021 since I've been at USC. We've established our team, which includes myself, a full-time coordinator, and interns from various schools. We're working with training and organizational development to integrate health and well-being elements into onboarding and new hire orientation. And we've also produced several guides and resource directories. We've offered high impact programming such as Healthy Habits at Home and our Fight On Football Wellness Challenge. And we provided recommendations on health and well-being practices and policies for the future of work recommendations, as well as onboarding for supervisors. So that's a look at what we've done so far. Thank you so much. And here's our contact information. Thank you.